Anxiety. That's what moms get when they're raising sons with disinhibition, right? Anxiety is what Tourette's is about too, because anxiety exacerbates all of the symptoms, especially tics and Tourette syndrome. I decided to look up the definition of anxiety because I think of anxiety as kind of a clinical diagnosis, and stress, which we talk about all the time to avoid, as something we all have. But actually, they're synonyms. Anxiety and stress mean the same thing, according to Webster. So, but anxiety is one of two things. It's caused by, it's uneasiness of the mind caused by fear of danger or misfortune, or it's an intense, tense desire or eagerness to succeed. So our kids are faced with both sources of anxiety, both ways of exhibiting anxiety, because they're always fearing that tic that's going to come out at the wrong time, or they learn that they have disinhibition and they're fearful for what they're going to do next. There's all kinds of reasons. Or they're eager to do better because they're not succeeding in their schoolwork the way they know they can for some reason, executive dysfunction. I like this quote from Joseph Chilton Pearce from The Magical Child. "The minute anxiety arises, intelligence closes to search for anything that relieves anxiety." So if you're trying to fight the anxiety, you have no chance to show your intelligence, to think. It creates a vicious cycle. Okay, the teacher asked me a question, but I'm anxious anyway because I have to speak out loud in front of others. I know the answer, but I'm so anxious, I'm not sure that I can remember what the answer is. Reducing stress in the environment or with the other children or in the homework assignments is usually my first recommendation to the educational professionals that I'm talking with, or at an IEP meeting, or giving advice to a parent. Sources of anxiety for kids with Tourette. The obsessive compulsive disorder has a relationship to depression, ADHD, to mood swings. The kids are exhibiting so much effort to control their obsessions. It's more taxing than it appears to the casual observer. You wouldn't know that they're working so hard to suppress the tics. It might cause an increase in tension, so it just becomes, again, a vicious cycle, leading to chronic anxiety, actually. Multiple tasks at once, I think, I added to my list because now I see in my own grandchildren and in even adults, they're trying to do multiple things at once. They're trying to listen to a lecture or watch their child's soccer game while also texting or checking their phone messages. We don't do one thing at a time anymore. And our kids don't either. Our kids want to have stimulation of several different sources. And I think that is very anxiety producing and not good for our kids with Tourette's. Tics, of course, very self-explanatory. They lead to embarrassment. The kids are trying to suppress their tics and they don't want to stand out from others. So that leads to anxiety. And there's social deficits. And as far as tics, the focus becomes the tics, not what other students are able to think about at the time. The child that's in the classroom with tics is thinking about trying to suppress those tics, not about the question the teacher just asked. Social deficits are also a big contributor to anxiety. The kids don't have a clue what to do in certain social situations. And it's not just anxiety, it's downright panic. I have a grandson who's a good example. He doesn't have Tourette's, but he has Asperger's. he would just disappear, even in a large family gathering with his cousins that he knew very well and his aunts and uncles. He just disappears. He doesn't know how to handle this situation. I remember one time I gave him my camera, and I said, he was just pretty young, and it wasn't expensive. I said, go take some pictures. And just having that camera there was just the best thing for him, because then he'd go up to people and say he'd want to take their picture, and it really opened some doors for him. He said, your son is into photography. Right. It was a very effective tool, and it was out of desperation on my part, actually. But the social skills really need to be addressed. Back when my son was young, they did do a social skills group. There was a group of young people that would get together during this lunchtime, probably, as I recall. They didn't know why they were in this little group, but the purpose was to deal with some skills. My grandson is in that same kind of a group. Another suggestion is, if this child is a social outcast and has no one to be with, appoint someone in the school to have lunch with him in the lunchroom so that he's not sitting there all alone. Role playing, of course, was mentioned earlier, is a great way to teach some social skills. Focus on one or two deficits, like looking in the eyes, or how to shake hands, or whatever the positive strategies that would be. And also creative methods of teaching appropriate social interactions, such as if you are so close to the person that you can touch them, then you're standing too close. You have to back up. And then teach them methods of understanding social cues. And it's something I obviously failed at with my son, because I remember when he was invited to a party, and he was so excited. It was a birthday party, and it was those 6th, 7th, and 8th grade years that were the most terrible for him. And he didn't know how to fathom this invitation for its full meaning. This girl had invited him to come to her house. And my husband, he got all excited, bought a gift, got dressed up. My husband took him up to the house, and there was no one home. So it was a joke played on him, and it was bullying. Yes, absolutely. You know, and it's interesting because he got a lot of that in those grades, a lot of bullying. But just a few months ago, my daughter discovered, he has an older sister, she's 3 years older, she went to the same school. She discovered a website where all the children that had attended that one particular elementary school were interacting. And my daughter was reading it, and someone put down, do you remember that boy in our class who had Tourette Syndrome? Remember how mean the teacher was to him? And it was true. He had one particular teacher, a science teacher, who wasn't buying this Tourette Syndrome thing. He wouldn't let him use his recorder in the classroom to record the lectures. He insisted he memorize the elements. You know, he couldn't memorize his multiplication, right. Never did, and couldn't memorize the element chart either. But the students did lots of bullying, but it's interesting that her comment was about the adult that bullied, basically. And that just shows that adults have to set the model. They have to model behavior for the students. An occupational therapy evaluation would be a really good thing to determine sensory issues that have to do with the anxiety that this kid is coming up with. I remember when we had a conference, and it was a panel of different professionals, one of whom was a nurse. And there were a large group of people sitting in the audience, a lot of mothers, a lot of moms. And this nurse said, do any of you have to cut the tags out of your kids' clothes? And all these heads went like this. And that's the first time they discovered with each other. This is, you know, not 20 years ago, but maybe 15. That's the first time we all looked at each other and went, oh, that's part of this picture too, you know? So I didn't know about those things in my son's life until I learned that, and then I started really observing him more closely and getting to realize that that was another issue in his life. It's why his shoes were never tied. He couldn't stand the feel of his shoes tied. They were always loose. Well, that was before Velcro, you know. Thank goodness for Velcro. It's a good idea to have regular meetings with the student to discuss positive preventive methods for dealing with future situations that will produce anxiety, and especially when it comes to social situations with classmates. And another area that leads to anxiety for our kids is the inability to fulfill the expectations of parents and teachers. Difficult behaviors may be the only way a student has to demonstrate that there is an unresolved problem. So we need to ask ourselves, is what we're asking of this child beyond their capabilities, maybe at this moment, or maybe this day because it's been a bad day, or this week because it's going to be a holiday in another week and they're too distracted? Does he understand the directions? Does he have processing that allows him? Is there wait time after the directions so that he can process? Or did I give him, or you give him, did we give him more than one instruction at a time? Which doesn't work. You have to give one instruction and wait for him to carry that out. I couldn't tell my son, after dinner, you do your share with the dishes, then you go feed the dog, then you do your homework, because he'd only remember the first one. Then he'd think he was done for the night. Does the student require support with writing? And is the environment overwhelming? I have to say ditto to the classroom that you were describing that was very, very overstimulating, because I walked into my grandson's classroom and she was a wonderful teacher, lovely, and the room was so filled with pieces of paper dangling down and fluttering, all colors. There were things posted everywhere with kids' names on them, different shapes, and it was totally overwhelming. And luckily, that was not the grandson that has all these problems. That was the middle child. I was so relieved.
But there was probably somebody in that child's classroom for
Yes.
whom all that visual stimulation was extraordinarily distracting and would make learning very difficult.
Yes. And think of the anxiety. The whole time they're in their classroom, they have to deal with that. One of the recommendations I have is look at what you can do for the student instead of to the student. When he displays difficult behaviors, maybe he needs some time out for himself to deal with stress. Teaching strategies to deal with stress is important, and it's more effective than punishing. Punishing just shows the student what not to do, but it doesn't really reveal anything that should be done. And be aware if a strategy you give the student is going to increase their anxiety. Remember, these kids are very concrete thinkers, so things are absolutely good or absolutely bad. So I have some do nots and do's. Do not threaten consequences to a child with stress, with Tourette's. Do not plant the suggestion of a misbehavior, because they'll do it because they're disinhibited. Yeah. Don't jump up when the bell rings, you tell them, right? Guess who jumps up first when the bell rings? Don't present threats in the form of a question. Restart a confrontation by immediately demanding that they do something different. Don't rehash old incidents. Don't have more than one staff person on a kid at the same time to discipline. And don't ignore their attempts to communicate. I attended an IEP meeting with a mother and her student and her son, and the principal was a very, very authoritarian figure. And he was threatening. He was threatening. He said, I know how to take care of you, don't I? You know, and he would say these things to this boy. And I went in thinking this boy really needed my help. And by the time that man was through with this meeting, I'm not so sure I like the kid anymore, because, you know, I had the idea that this is a real problem this kid is. But some do's. Remain calm physically and verbally with a stressed child. Provide time to shift gears, and that leads me into transitions, what I'm going to speak on next. Avoid debates and sarcasm and put-downs and power struggles, which was exactly what that principal was into. He was into the power structure. He was the authority. Choose your battles and use humor. I found humor. I tend to be the crack up in our family anyway, and I tended to use humor in raising my children, and I found that it really de-stressed matters. And I kind of passed it on to my kids, I guess. But my daughter would, my son would be ticking, and he would do this all the time, okay? Well, my daughter decided to name it his blonde tick. And he still laughs at that to this day. They still tease each other about that, and he doesn't do that tick anymore, but she said, remember the blonde tick? You know, see the humor in things, and that really helps them to see life isn't so bad.